All right. Hi, everyone. Thanks for being here today. I think we're going to go ahead and get started. We have quite a lot to share with you today, but stick with us. It's going to feel like a lot of information, but ask questions. We'll share everything so that you have access to all of the resources after the session. But we'll go ahead and jump right in. All right, so welcome everyone. Excited to have you here for this conversation today. Throughout the session, please feel free to come off mute, share questions in the chat, connect with each other. We are going to start with a Halloween themed icebreaker question. This is well, I've been asking all of my friends what their kids are going as for Halloween because I always love to hear what they're dressing up as. But the check-in question today is what's your favorite Halloween costume? Either one that you've worn or your child has worn or you've seen somebody else wear, um, or anything Halloween related that you want to share. I've been hearing a lot of K-pop demon hunters from my friends' kids, which I still haven't seen, so I need to get on that. But I feel like that's been a very popular Halloween costume this year. And then Uh, my friend has a 1-year-old who has two teeth, and he's going as a jack-o'-lantern. Um, so I'm excited to see his costume. Marilyn Monroe. Oh, that's a really good one. Oh, we just got a bunch. Goblin King. Oh, Jared from The Labyrinth. Oh, Clue. That's a good one. Mrs. Rachel. Oh yeah, I love the Jurassic Park costumes that I've seen. Oh, Melissa, I was gonna ask you what Emmy's going as. That's so cute. Harry
Yeah,
Potter.
sorry to be a pain.
Mute. Well, thank you all for sharing. I am excited for Halloween, so thanks for bearing with me on that. So welcome everyone. I think we have a lot of familiar faces in the room today. But just as a reminder, this is a space for Medi-Cal transformation stakeholders to collaborate, identify challenges, problem solve, all with the goal of improving CalAIM implementation and utilization. So please, this is your space. Feel free to engage with each other and ask questions throughout our session today. So for our agenda, we're going to have some updates that we're going to share with you, some DHCS policy updates. Partnership will share some updates as well. And then we'll move into kind of the bulk of our section today, which will be focused on braiding and blending funding. We're going to talk about some case studies, definitions, different approaches, and then we're going to have a spotlight from Hank, and then we'll have a little bit of a discussion as well. And then we'll close out with some resources, some upcoming convenings, and some information about the November session as well. So for today, our objectives are to review important statewide DHCS policy updates, MCP updates, and resources. We'll learn about braiding and blending funding to support sustainability of services. We'll discuss braiding and blending funding and have a chance to hear from a local stakeholder on their best practices, and then receive details about upcoming office hours, sessions, and some work groups. So we have one poll to get us started, and we are wondering if you or someone on your team is interested in joining a Northeast specific mobilization network to engage stakeholders in coordinated sustainability planning for 2026 and beyond. So I'm going to launch this poll. And also, Melissa, if you have anything you want to add about
Yeah,
that.
I know last month when we met in person, sorry, that feels like so long ago. We had briefly talked about the mobilization network, and there were a couple folks who had mentioned they were interested in learning more about it. We are planning on kind of launching a small group, especially as we go into the following year and think about kind of closing out the PATH CPIs. So wanted to see if there is anybody who's interested in joining that. We'll be kind of hosting some conversations around that and more to come in the new year as well. But just wanted to kind of get a little bit of a temperature check at the onset.
Yeah, so we'll give it a few more seconds. And I'll go ahead and close us out. Okay, great. So it looks like a lot of folks would like to learn more about what that would entail, and so we can follow up with you. And then those of you who said you were interested, we will reach out to you as well. All right. So moving into our cross-sector policy and regional updates. The first one that we have is on Senate Bill 660, which updates the California Data Exchange Framework to strengthen how both health and social service data are shared across the state. And so there's some key provisions that are included here, including the authorization for the Department of Healthcare Access and Information, or HCI, to take over the establishment, implementation, and all functions related to the data exchange framework. HCI is required to convene a stakeholder advisory group. It adds emergency medical services to the list of DSA signatories and adds some oversight and enforcement privacy protections, as well as some contracting stipulations. And so just to kind of highlight, how this would impact you is if you've signed the DSA to gain access to secure data sharing, honored member preferences, expanded oversight, and supportive provider infrastructure. And I will drop the link to that so that you can all take a look at that as well. Um, and then moving on to our next update, on October 10th, DHCS released the latest ECM and Community Supports Quarterly Report, covering data from January 2022 through March 2025. And these services help Medi-Cal members stay healthier and avoid more costly healthcare services, as we all know. And we wanted to provide a couple of key highlights from the Q1 2025 data. When we do link the deck from today, there is some more detailed data about the Northeast counties. It's a lot, so we're not going to go through each one, but we've pulled that out just for ease of kind of not having to go through data for every single county that's listed. But a couple highlights, ECM enrollment increased 61% compared to Q1 of 2024. ECM enrollment among children and youth more than doubled. Community supports reached more than 429,000 members, with more than 1.1 million services delivered. Nearly 94% of Medi-Cal members have access to at least 10 community supports, and the most used services include medically tailored meals and housing related supports. So I will also drop the link to that report, but just wanted to show, the impact of a lot of the work that you all are doing, and share those highlights with you. And I will pass it over to Melissa.
Thank you, Eva. Thanks everyone for joining us today. I wanted to quickly provide you guys with an update on some of the newly released FAQs, really highlighting the relationship between BHSA housing interventions and community supports. I know during the in-person session, we had a lot of questions around transitional rent, and the MCP will be providing an update on the status regionally, but this is more of a statewide BHSA and transitional rent update. So it is not going to be entirely applicable to the regions because there are some dependencies on your MCPs. But just to kind of reiterate some of the distinctions and things that are similar here are that both transitional rent and BHSA housing interventions do both cover rent, storage, and amenity fees and landlord paid utilities. I know there was some questions around this stuff and payment methodologies, and I'll share a little bit about that after. But some of the distinctions here are that transitional rent is more of a short-term offering. It is up to those 6 months, and very dependent on whether an individual uses other types of housing interventions. The BHSA housing intervention, though, can provide longer term support and complementary services. And the counties are really encouraged to coordinate with MCPs for sustainable housing, for example, the HUD vouchers. These FAQs really focus on clarifying how both of the programs align to support individuals experiencing risk of homelessness, and really lean into the welfare and codes. So the key point here is that BHSA housing interventions cannot fund services already covered by a Medi-Cal managed care plan. Counties may not use those BHSA funds for housing-related community supports available through Medi-Cal, but they can, again, fund complementary additional services. So that is something that is within those codes. That's important to take note. And the reason why it's really important to kind of focus in on that is because there is a lot of overlap between these two, which we'll show in the next slide, please. So a lot of times we're kind of wondering, how do we braid funds, or what's the distinction between the housing interventions and the transitional rent? In this figure, you'll see that for transitional rent, it is actually recommended that if an individual is eligible for transitional rent and housing interventions, that transitional rent come first. So from month 1 through 6, you could use the transitional rent voucher or interventions. And then starting on month 7, you could use the BHSA housing interventions. You'll see that these two are pretty similar. So transitional rent covers interim housing, rental subsidy, and storage fees. And then at month 7, BHSA housing also covers those very similar things. If you do want to braid the funds, there is also the possibility to use the BHSA housing interventions overlapping the transitional rent for pet deposits, renter's insurance, other occupancy, and so forth that you can see here on the slide. But just wanted to kind of let you guys know that there is a way to kind of braid the funds and ensuring that, you can kind of use them from month 1 to 6, and then starting the housing interventions at 7. Next slide, please. One of the key things that is highlighted in the FAQs is the streamlined provisional authorizations for BHSA housing and transitional rent. So this is in figure 2, an example of the streamlined provisional authorization timeline flow. In order for county behavioral health agencies to conduct these authorizations in a streamlined manner, the BH agency has to be contracted with the Medi-Cal members MCP as a transitional rent provider. They have to make sure that the member is BHSA eligible and commit to providing the Medi-Cal member with BHSA housing interventions at the expiration of transitional rent or upon denial of the request. The BHA agency commits to sending a referral and request for authorization to Medi-Cal members MCP in a timely manner. And then, consistent with APL 21011, the MCP must authorize or deny coverage of transitional rent within the shortest applicable timeframe. So you'll see here in the figure that typically the county will determine the eligibility. Then they'll send the referral request to the member's MCP. If the MCP approves the request, then the individual can then use that transitional rent from months 1 to 6. And again, there is a stipulation here that if they've used other types of deposits or things like that, or short-term post-hospitalization, that this actual 6-month time frame may be reduced. So it's important to take note of what the individual has already been used when you are submitting that referral. And the MCP will usually check on that as well. If the MCP denies the request, then the county is able to fund just via those BHSA housing interventions, and that starts from month 1 and forward. But it is likely that they will be encouraged, if they are eligible, to use the transitional rent first. I'll pause here. Actually, we can go to the next slide and see if there are any questions. I do recommend that everyone goes through the FAQs a little bit more thoroughly. There is a lot more information in there, and I really just tried to pull out the more salient points. But we have a quick little poll where you can drop any questions that you have, and then if we can come back to these, we can answer them at a later time. But happy to field anything right now if there's any immediate questions regarding this. Okay, Eva, we can leave the poll up, but let's go ahead and go to the next slide. The other thing that just came out from DHCS, so hot off the press, is the transitional rent payment methodology component. So the transitional rent payment methodology components come under two components. The first is the cost of rent or temporary housing. So this is a fee that will be covered. DHCS will reimburse MCPs the actual cost of rent or temporary housing paid to landlords or property owners. Up to the applicable reimbursable ceilings. So those reimbursable ceilings are in line or tied to the percentage of U.S. housing and urban development small area fair market rents. And DHCS does expect that those actual rent or temporary housing costs will vary from case to case. There is a table in the link that Eva just dropped in the chat that essentially highlights, those different types of reimbursable amounts or ceilings. The other component for payment methodology here is the administrative fees. So this is more MCP specific, but DHCS will pay MCP's administrative fees to cover the reasonable costs associated with delivering the transitional rent service. Those fee amounts will cover the administrative cost of the MCP and the transitional rent provider. The only stipulation here is that the administrative fees are very regionally specific. And so if you are in different counties, it's important to look at those fees and determine what the distinction might be, especially if you're providing services across MCPs or across county lines. So really encourage you guys to look at that. There is, however, if you go to the next slide, Eva, a webinar that is coming up. So DHCS will be hosting a webinar on this transitional rent payment methodology to really cover those associated fees and administrative. So this is happening on October 31st. Advanced registration is required. So again, encourage you all to review that before you jump in. We can also field any questions. So we'll have another poll that comes up right now for any of the transitional rent payment methodology items. And that is, I think, my handoff to the MCP. So we'll leave the question open here, but we'll hand it off to the MCP for presenting.
And who from partnership is gonna, I think I had Brittany presenting, but I don't see Brittany here. Anyone from partnership on the call that can speak to the
Are you able
slides?
to hear me?
Yeah,
Okay. Sorry about that. I think I'm having audio issues with
no
my
worries.
phone. Yeah, so nice to be here. Hope everyone's doing okay. My name is Joshua Urango. I'm a project coordinator here, part of the ECM team. And just to provide you with some quick updates from partnership. So going into the agenda, we will be discussing the asthma remediation webinar, transitional rent, and Medi-Cal renewal resources. And then, as you may have heard, the asthma remediation will go live January 1st, 2026. And also the Regional Asthma Management and Prevention, also referred as RAMP, will provide an overview of this service as well as answer any questions you may have. All providers who are interested in contracting as an asthma remediation provider should attend to better understand the program. The webinar will be held on November 6th at 10 to 11 a.m. And if you have any questions, you can email our community supports team, which is at communitysupports@partnershiphp.org. Right, and then I could put a registration flyer if you want to go ahead and register for that. Right, next slide, please. And then for the transitional rent, this will go live January 1st, 2026. We are continuing to work with county behavioral health agencies, and many have began contracting with partnership for the first population focus, which is the at-risk of homelessness. DHCS approved our contract template, but partnership is waiting for the final policy guide and referral data requirements to be finalized. And then also, if you do, again, I want to review that. You can review on that PDF down below, which I know is already provided in the chat. And then next slide, please. And then in order for members to qualify for the transitional rent, they must meet the following criteria, as you can see. So members will need to meet the access criteria for Medi-Cal specialty mental health services or drug Medi-Cal or the drug Medi-Cal organized delivery system. Next, they will need to be experiencing or at risk of homelessness as defined by the U.S. Department of Housing and Urban Development. And then lastly, they'll need to meet the criteria for specified transitioning populations. Just to provide a few examples, but not limited to, such as transitioning out of an institutional or congregate residential setting or carceral setting or recuperative care. And if you want to find more information regarding this, you will want to review the DHCS Community Supports Policy Guide Volume 2. Next slide. Thank you. And then for the Medi-Cal renewals resources, here are some available resources to help the members keep their Medi-Cal active to ensure that the members renew on time, so without any interruptions. Members should be on the lookout for a yellow Medi-Cal renewal envelope, send back their renewal forms on time, and if they miss a renewal notice, they'll have 90 days after the renewal date to turn these in before losing coverage. And that's all I have. Last slide is questions. If you have any questions to ECM, community supports, or claims, those are the email addresses you would want to contact. And if you are a contracted ECM or community supports provider, you can sign up for our CalAIM office hours, where we'll provide more monthly updates regarding ECM and CS. Thank you.
Thanks, Josh. Does anyone have any questions? All right, then I think we can move on. Thanks, Josh. Just wanted to provide a moment for anyone who has any updates or spotlights or upcoming events or meetings that you'd like to share with the group. I'll just pause and see if anyone has anything they'd like to share. Okay, then I think we can move in to our next section on braiding and blending funding, and I will pass it back to Melissa.
Thank you, Ava. So we just wanted to quickly introduce some information that was just released by Center for Healthcare Strategies, sorry, and the California Healthcare Foundation. They recently put out a brief exploring strategies for optimizing braided funding to enhance integrated person-centered care for Medicaid enrollees, featuring profiles of 3 organizations across the state of California that have successfully implemented strategies to braid funds specifically for ECM and CS. We do have a guest speaker with us today to talk about a more regionally focused type of braiding and blending funding example that they've done, but just wanted to highlight some opportunities that we've observed. So braiding Medi-Cal and non-Medi-Cal funds can help healthcare and social service organizations maximize funding and address budget gaps and support financial sustainability. I know we briefly talked about this during the in-person last month and mentioned that we would be bringing some of this information forward. So wanted to start highlighting this, especially as we will be onboarding a financial advisor who will be supporting a lot of the work moving forward to give you guys all the tools, resources that you need to really determine how to braid and blend funding, especially as the state has seen some funding cuts and there's some changes to Medi-Cal and Medicaid as well. So just wanted to note that this brief is available. There will be a link put in the chat, and then we'll kind of cover some of the other key components that are highlighted in it. But for now, I will hand it over to Haley, who I see is on camera, I believe. Haley, if you don't mind just kind of talking through some of the braiding and blending funding that you've done and also some of the highlights here on the slide.
Absolutely. So hello, everyone. Can you hear me? Okay, perfect. It's all working well. So I'm Haley Mendoza. I work for the Health Alliance in Northern California. I'm the Director of Workforce Development. The Health Alliance of Northern California, we actually received an ACEs Aware grant to support the implementation of enhanced care management for children and youth at two pilot community-based organizations. The first one is Tri-County Community Network, and the other is the YMCA. Tri-County has actually already gone live with ECM services, and the YMCA is expected to launch ECM in November. I see it says January here, but they are expected to launch as soon as next month. So with these funds, we actually convene a community of practice work group for organizations that are either already providing ECM to children and youth or are interested in doing so. Throughout the process, we provide technical assistance by coordinating presentations with a great deal of support from partnership. HANC, for short, is the Health Alliance of Northern California. We act as a liaison and offer resources, networking opportunities, and training to upskill case managers. The grant funding has really allowed our pilot community-based organizations to either hire ECM case managers or continue to upskill their current employees while awaiting contracts with partnership. They began building the foundational knowledge of ECM and prepared to deliver more efficient, coordinated care. I'd say that was the biggest benefit of this funding to support them in the interim of building that contract with partnership. And then once ECM is established for the case managers, really the billing that ECM provides, it allows them to become self-sustaining billable providers and hopefully expand services to support more clients. I'm trying to see if I have anything else on this slide that I missed, but I'd love to take any questions that you have about this process.
Thanks so much for sharing, Haley. Would you be able to share what types of funding you kind of either utilized for this and any requirements that were either mandatory or, something that you had to monitor or observe to make sure that you weren't overlapping the funds or anything like that?
Absolutely. So the ACEs Aware grant is essentially the grant that's allowing us to push this work forward. The purpose of the ACEs Aware initiative is to expand ACEs prevention and response services. And so the way we wrote into our work plan was how we were going to first and foremost expand ACEs, expand the prevention and response among Shasta County, but also how do we increase those access points? And so we decided to do that through the implementation of ECM. Our CBOs, of course, are using some of their own funds to support the ECM work, but the goal ultimately is to have them become those sustainable, those professions to continue to be sustained through the billable portion of ECM. So, does that answer your question, Melissa?
Yeah, thank you. And Amber, I see you came off mute. Did you want to ask a question?
Yeah, thanks, Haley, for the presentation. It's always very cool to hear from you. I was wondering that practice group that you talked about, if that's open, because Shasta Community Health Center is serving youth as well too through ECM, and we'd love to connect with other providers who are.
Absolutely. Yes. Thank you for bringing that up, Amber, because we do have an ongoing community of practice work group that meets monthly, and we are always welcoming new partners to join and share their insights into how they're providing ECM services to children and youth, or if they're interested in learning more about that. We actually started this work group in January, and it began with the basics of ECM, what it is, and how to contract with partnership. And each month has been a step in the process of establishing ECM within organizations. And so we're hoping to continue the community of practice past the expiration of the grant and continue to cycle that process over again. So start from the beginning and continue on. Amber, what I'll do is I'll put in the chat for everyone who would like to participate. If you'd like to send me an email, and I'll make sure those who would like to join can be invited.
That would be awesome. Thanks so much, Haley.
Of course.
Thank you. Anyone else have any questions? Would anyone like to share any examples of how they've braided any funds or done any of this work? Okay, we'll go ahead and move over to some key definitions. So just wanted to highlight very quickly some of what we pulled from Haley. What you had said was, you did some of the braiding of the funds, right? So this is not just you guys at Hank, but also some of those other orgs that you were working with, for example, the YMCA and TCCN. So some of these examples are really leaning into the braiding and supplanting of funds. So this includes combining funds from multiple sources to support a common goal while ensuring that each funding source maintains its specific program identity and can be tracked independently. And then there's the supplanting. So when an original ongoing funding stream is replaced with a new funding source to deliver the same service. Some other types of definitions here are the blending. I think from what I've heard is that the blending is probably the most complicated because this is where you're mixing funds from multiple sources to support a common goal. But it's really hard to distinguish and track things separately. So there are some risks here, but we can also kind of go over some of the risk mitigation strategies in another session. And then there's, the sequencing, which is very similar to what we heard with the housing interventions and transitional rent. So just wanted to kind of call out some of those examples. And then in the next slide, there are additional examples of these braiding and funding approaches. These are specifically from the brief that we put in the chat. And so you can see that braiding can take place at two levels. There's the funding for services delivered to the client. This includes clients that receive services at a specific point in time that are funded by a single source or multiple sources. So anything that's a single source per client and single source funding per client, that's not considered braiding. But if it's single funding source per client facing staff member and multiple funding sources per client, that's, a form of braiding. And the Children's Institute, which is here in California, has some examples around that. Choice in Aging has some examples around multiple funding sources per client facing staff member and single funding source per client. And then RH Community Builders has the other kind of section there that you see. And then the funding for client-facing staff, that's usually where staff members who deliver services may be funded by a single source or by multiple sources. So again, if you're an organization that's already providing services to a certain population of focus, but not through ECM or CS, that can kind of go under those multiple funding sources. We are going to put up another poll here just as an open poll for you guys to add any questions if you have anything. If you have any questions for your peers that you would like answered, we'll again come back to these and prepare some of the upcoming content around these questions that are coming in. So I will have Eva leave that open, but we'll go ahead and go to the next slide in the meantime.
Can I just add something real quick, Melissa?
Yeah, go ahead.
I think it's just really important. I love the talk about braiding funding because so typically it's really common for agencies to be like, nope, this fund is for this and this fund is for this. So I think just us being open to the conversation, I think a lot of people, when they hear supplanting, they think of that as a negative thing because typically it's like you can't supplant funds with another fund. But just really opening it up, I think is really helpful. I know one of the things that has been I believe a strength of ours is we involve our billing and our grants team in these conversations. So just for those out there who are kind of wondering about like long-term sustainability, and if you want to do this, I would highly encourage, like, if in your agency there are different people who hold the roles for like finance or going after grants, to really include them, because they're going to know a lot of different options too that might be able to keep your program going.
Absolutely. And thank you, Amber, for the reminder, because in the brief, there are actual examples of how these organizations, not went around supplanting, but kind of went the route of supplanting or braiding and blending. And they all have unique risks, but they also have workaround strategies as to how they've made it work. So really important to kind of look at those different ones if you are interested in this. Thank you so much. Any other comments, thoughts? No? All right.
Great. So we will move into next steps and just share about a few kind of opportunities that are coming up. The first is a CPI best practices webinar on October 24th. DHCS will host this. It's strengthening connections with children and youth providers. And I'll drop the registration link in just a second. But this webinar will demonstrate how First Five programs across California are working with ECM and community supports services and providers, and discuss how schools and districts help connect children and families to local organizations, youth programs, and health plans. Guest speakers will include First Five Center for Children's Policy, Camden Coalition, Chapman Consulting, HC2 Strategies, Population Health Innovation Lab, and Intrepid Ascent. So a lot of great, folks involved there. And I will drop the registration link for anyone who's interested. Um, we also wanted to share that Health Begins is organizing a justice involved ECM work group. And this is for Northeast justice involved ECM providers who are actively receiving ECM referrals from the California Department of Corrections and Rehabilitation, or the state prison system. And folks that are involved in this work group will discuss amongst your peers about lessons learned, best practices for receiving these CDCR referrals, including engaging in pre-release warm handoffs, billing under Medi-Cal fee-for-service and managed care, and transitioning members to that post-release ECM. So we have weekly sessions scheduled for 1 hour on each of these dates, October 30th, November 6th, and November 13th. And I will drop the link for registering for that 3-week series for that work group for anyone who's interested. And then we also wanted to share about our office hours this week. On Thursday this week, October 23rd, we're going to have an office hours, joint office hours with San Joaquin and Stanislaus Collaborative as well, focusing on marketing and referrals best practices. And so during this office hours, we'll review 2 key resources. One is the referral best practices toolkit, and the provider network and awareness best practices toolkit. We'll discuss examples of how others are applying these tools. You'll all have an opportunity to ask questions and gather feedback, and then discuss opportunities to integrate these resources into local efforts. So I will drop that office hours link as well for registration. And then some information about our November session that will take place on November 18th at 1:30 p.m., not a.m. And I'll drop the link in the chat for that session. And then, as always, we are here for one-on-ones if you have any questions about anything related to Medi-Cal transformation or the CPI. So please always feel free to reach out to us with any questions specific to your organization. But that is all we have for today's session. Thank you all so much for joining us. As always, I'll follow up with all of today's materials in a follow-up email. Christina's asking any update on Path 4. Melissa, do you have?
Yeah, there was a communication. It was very vague that you guys should be receiving updates by this kind of in these kind of months. It said fall, winter. So I would expect something. I think last time they were around October, November as well. Sorry, super vague, but there was a update.
No, that's fine. I appreciate that because when we submitted for Path 4, it said October is the anticipated timeline, and I know that's not a concrete thing, but we haven't heard any communications recently saying anything differently, and I was just curious if anybody had heard anything that is more concrete. Even if it's
Yeah.
wet concrete, that's fine with
I
me.
I think October to November. So I know that PCG is the funding kind of entity that oversees everything, and we're funded by them, and we're supposed to get notice of like our general funding for the collaborative PATH CPIs in November. So I assume that's all going to kind of come around at the same time. And I know that the Northern California Northeast region received an influx of applications, and I think they're prioritizing rural areas, so hoping that everyone will get awarded. But I would say probably at this point, maybe the end of October, beginning of November. Any other questions?
All right. Well, thanks everyone. Have a great rest of your week, and we'll hopefully see you in office hours this week. Thanks. Bye.